Hello everybody, I am Dr. Vikram Mhaskar, a knee and shoulder surgeon, and today we are going to be talking about three very unique cases. Why are they unique? Because they underwent operations by me which were kind of special and they did quite well at the end of it, and they're going to share their journey with us. So we start with our first case. So this gentleman came to me with a problem in his knee after a sporting injury. He was feeling his knee was not stable. He'd got an MRI done. MRI showed that one ligament was broken. When he came to me at the clinic, I examined him and I found that it was a little beyond this. Though the MRI showed just one ligament, the second ligament also seemed to be broken. So he had an ACL or anterior cruciate ligament tear and a medial collateral ligament tear. So I scheduled him for an operation. It was Corona time, so everybody was worried to get admitted to a hospital. And I do a lot of these surgeries as daycare. That means I operate on the patient in the morning and send them home by evening. So he decided to get himself admitted in the hospital. I said, all right, Vaibhav, get admitted. I got him into the hospital, said hi to my patient. He had his anesthesia by 8:30, 9 o'clock. I examined him under anesthesia and found that my findings were right. Remember, in any ligament injury, your clinical findings are as important as the MRI, and it's best done when the patient is sleeping or in anesthesia. So I went ahead, I did his ACL reconstruction, preserving his old ACL, whatever it was, and put in a new ACL, as well as did an MCL reconstruction. Now this is considered a multi-ligament injury. Now I did this in the same setting. It took me about an hour and a half. Vaibhav was up and about within 2 hours of the operation, walking with a walker, going to the bathroom. He had a brace on, and then he just progressed like a dream. He went back home the same day by evening. He sent me videos on how he was progressing, hit the gym by about 2 to 3 months, and now he is back playing football. And here you can see him dribbling the ball like a dream. We now talk about our second case. This is Mr. Abhinav Nagar. Abhinav is a kid. He was only 16 and 17 years old. Now he had worried parents because he had a road traffic accident. He fell down from a bike and had his knee injured. Now when he came to me, I found that his posterior cruciate ligament and his posterolateral corner were both broken. Now this was quite a major injury for a child because anything could have gone wrong. So I convinced the parents and I told them that he needs to be all right. And his father said, "Doctor, we trust you. We want you to make our son all right." And I said, "It's my responsibility and I'll do my best." Took him to the theatre, examined him under anesthesia. You can see his knee is absolutely unstable in a front to back direction. You can see the leg bone is going so much back, and he was opening up on the outer side. I did a posterior cruciate ligament reconstruction. So the posterior cruciate ligament prevents the leg bone from going backwards. Now this is a very important ligament in your body, and reconstructing it in a child like this was very important for him to have a stable knee for the rest of his life. Now this is a very difficult reconstruction because all the work is done at the back of the knee and the blood vessels are very close to it. So one has to be very, very specialized and very careful while doing this reconstruction. It went beautifully. I also did his posterolateral corner reconstruction. And here you have him sprinting away to glory, hopping away to glory, and feeling good. And this is what he has to say about his whole experience.
मेरा नाम अभिनव नागर है। मेरी उम्र 16 साल है। 21 दिसंबर 2020 को मेरा एक्सीडेंट हो गया था, जिसके कारण मेरे पैर में चोट आई और बहुत दर्द हुआ था। और मतलब एक हफ्ते के बाद मेरा पैर का दर्द सही हो गया था, पर मुझसे चला नहीं जाता था और नई रनिंग होती थी, नई वॉकिंग होती थी सही से। और फिर पापा जी मुझे मैक्स हॉस्पिटल में ले गए। वहाँ पे हमें डॉक्टर विक्रम सर मिले। उन्होंने मेरी पैर की MRI कराई और MRI में 2 लिगामेंट टीयर निकले। फिर सर ने ऑपरेशन के लिए सजेस्ट किया हमें, तो फिर पापा जी ने सर पे ही ऑपरेशन करवाया, डॉक्टर विक्रम सर पे। और फिर मैंने 2 वीक्स के बाद बेंडिंग स्टार्ट करी पैर की और एक्सरसाइज स्टार्ट करी, और 3 मंथ्स के बाद मैंने वॉकिंग स्टार्ट करी, और 6 मंथ के बाद मैंने रनिंग स्टार्ट करी, और अब मैं सही दौड़ने लग गया हूँ। और मैं विक्रम सर का बहुत बहुत धन्यवाद करना चाहता हूँ, उन्होंने मेरा ऑपरेशन बहुत अच्छा किया है।
We talk about our third case now. Now this is special because this patient Kashish had shown multiple doctors. Nobody could make a diagnosis. Everyone said, you possibly have a meniscus tear, but we'll take it out, but we're not sure. When I saw him, I found that his pain on the outer side of his knee was unusual. Now, I usually just don't rely on an MRI because I feel MRI is a static investigation. It's like a photograph that you take of somebody. In a photograph, you get good information, but you don't get the complete information. Complete information is with a video or a dynamic investigation. And for me, it's the ultrasound. And I did an ultrasound of the knee in my clinic, and lo and behold, I found a meniscus tear on the outer aspect and a cyst. Now, the meniscus is very important to be preserved in your body because it protects your cartilage. And that's what I intended to do. And I told Kashish, this is what you have. I took him in for a meniscus repair, something he'd been suffering for a long time. I found the meniscus tear inside, repaired it. And here you can see him talking about his experience, and you can see him running like a dream in the gym. He's somebody who's lost a lot of weight, is super fit, and is an inspiration for everybody.
Hey, I'm Kashish and I'm 24 years old. Since 8 months, I was going through a knee pain which I acquired while playing cricket. This pain used to trigger whenever I would bend or straighten my knee. I consulted 6 doctors before coming to Vikram sir, and everywhere there were discussions about removal of meniscus. But on the day of surgery, Vikram sir preserved my meniscus by removing the cyst and performing meniscus repair instead of meniscectomy. I wouldn't say that this journey was a piece of cake. It required patience and utmost discipline. I strictly abided by all the instructions given to me by sir and the physios. After 6 weeks of complete bed rest, I started walking gradually. There wasn't any pain while bending the knee, but pain in few parts of the knee was still there till month 4, specifically in the lower leg. I followed a strict rehab plan, and as a result, after month 4, I started gaining stability and muscle mass on my right knee. I was 90% fine, but a pain in my lower leg was still there, which could be a result of some strain. After 5.5 months, I started jogging, and soon I was back to normal. I can again jog for 5-6 kilometers, I can again hit the gym. Although I do have to take care while doing weighted deep squats, I am delighted that I can resume my previous lifestyle and achieve further milestones in my weight loss journey, in which I have reduced 115 pounds. Thank you, Vikram sir, for preserving my meniscus and providing me a better future.
I hope you enjoyed these 3 videos. I hope it gives you inspiration. I hope it makes you feel that you want to get better. And that's my intention. If you enjoyed watching my videos, please like and subscribe to my channel.